Prescription Pain Overdose and Dependency Prevention Policy by Shivesha Patton. Hello legislators, my name is Shivesha Patton and I will be speaking to you today about the advocacy of a prescription drug overdose and dependency policy, specifically prescription painkiller medication. According to the CDC, around 46 people die each day from an opioid overdose. From 1996 to 2016, more than 200,000 Americans have died from a prescription opioid overdose. I'm here today to provide a presentation on a prescription painkiller overdose and dependency policy, which includes who this policy will affect, the impact it will have on the public, the changes that may occur with this policy in place, how lives will change for the affected population, the costs of the policy, and the risks and benefits of the policy being enacted. This graph represents the prescribing rates of opioid drugs from 2006 to 2017. As you can see, the prescribing rate has decreased dramatically over the 13-year period. The prescribing rate pictured is per 100 persons. This is because the misuse and abuse of painkiller medication has grown significantly over the years, and state laws have cracked down on the prescription of these painkillers. Yet why is opioid dependence and overdose still a problem if providers are not prescribing the medication as much as they were before? There is an array of painkillers on the market, but these medications are the 10 most prescribed and abused painkillers in the United States. They are oxycodone, methadone, morphine sulfate, Percocet, OxyContin, acetaminophen with codeine, Dilaudid, oxymorphone, HCl, Vicodin, and hydrocodone. Research concluded that 55% of users get their drugs from family or friends free of charge. Other sources include being prescribed by the physician at 17%, being bought from a family or friend at 12%, other sources at 7%, being bought from a drug dealer at 4%, being stolen from a family member or friend at 5%. This graph does a great job of demonstrating why access to these painkillers is an epidemic in America. The 55% in this pie chart would be called enablers because they are supplying these drugs to their friends or family and they are not being monitored closely enough to be cut down on the issue. This policy will affect those dependent and addicted to painkillers. This policy will also affect infants born addicted to painkiller medications because their moms use or misuse the medications while pregnant. Opioid abuse has become an epidemic in America and is senselessly killing Americans. Research shows that the abuse or misuse of painkillers can lead to more illicit use of drugs like heroin. This issue needs to be addressed because opioid-related deaths are preventable. However, people are still dying of opioid overdoses. This issue can be addressed with proper training, education, and resources. The next slide will provide an overview of the policy itself. The main purpose of this policy is to reduce and prevent the number of deaths associated with opioids in the United States of America. The first step in the policy would be to provide adequate training in providers so that they can identify patients that are seeking pain medication. The signs of drug abusers are usually unusual behavior, demanding or assertive personality, uncommon knowledge of controlled substances, requests for a specific drug, exaggerates medical problems, fails to keep appointments, mood swings, and scars and lesions all over their body. Step 2 would include each state having a PDMP, or Prescription Drug Monitoring Program. These programs are designed to monitor the prescription of painkillers. Each time a painkiller is prescribed, it's sent to an electronic database where it is stored and used to track suspected abuse or diversion. This program will help providers and pharmacists in identifying high-risk patients who could benefit from intervention. The third step in the policy would include patient review and restriction programs. State programs like Medicaid would track claims for painkiller medication and use it to seek out potential drug abusers. Research shows that low-income citizens are more likely to abuse painkiller medications. Step 4 would include better laws to prevent painkiller abuse and prevention. States should enact and enforce laws to prevent doctor shopping or doctor hopping. This term is used when a drug abuser uses multiple doctors to get the prescription that they need. This also includes close regulation and monitoring of pain mills, which are pain management clinics that are dispensing meds to patients inappropriately. Step 5 includes access to better drug and substance abuse treatment programs. The chances of a drug overdose is greater after the patient has been released from the program. This is because it is assumed that these people are returning to their normal lives, and they do not have guidance once they've been released from the program. This policy will address the issue by putting steps into place that could prevent or reduce the number of deaths associated with painkillers. The population who will be affected are those dependent on painkillers and babies that are born addicted to painkillers, also known as neonatal abstinence syndrome. It will affect those dependent on the painkillers because the drugs will no longer be accessible to them, and they will be court-ordered to go to a drug rehab program with an extensive curriculum to ensure that they will not relapse once they are released from the program. Supportive resources shall be available to them once they are released. Babies will be affected because there will be less babies born with NAS, which gives them a normal start at life. What will change is the number of deaths associated with opioids, the treatment programs, how painkillers are prescribed and tracked, education provided to the physician, staff, and patient, and better enforcement that help prevent the abuse of painkillers and other drugs. Impacts of the proposed policy. The cost of the policy will greatly depend on the patient's gender, age, socioeconomic status, race, health plan, and medical history. However, this policy will cost about $5.6 million over the course of 5 years. But what's important is that we reduce the number of deaths associated with opioid abuse. The $5.6 million would go towards expenses that include monitoring the prescription of painkillers, treatment programs, education for physician and patients, and for any other revisions that need to be made to the policy. The benefits of the policy are that it will reduce the number of those affected by painkiller medications and eliminate this preventable epidemic, and eventually will not be a public health crisis anymore. The risk of not enacting on this policy are that more people would die each year from opioid-related deaths. More people, especially adolescents and young youths, will be exposed to possible painkiller abuse and dependence. The epidemic will continue to get worse. Lives will be changed by this policy by enacting by providing help and treatment to those addicted to painkiller medications without judgment, and eventually eradicating painkiller dependence to ensure a healthy public population. Considerations. Members of legislation, I ask that you take my policy into consideration. To reiterate, my advocacy policy is about the prevention of opioid dependence and overdoses. Opioid overdoses that have resulted in death have affected more than 200,000 Americans since 2006. Painkiller overdoses are 100% preventable, yet it still continues to be a problem today. My proposal for preventing the number of Americans affected by painkiller overdoses include physician education and liability on the drug-seeking patient and how to identify them, the use of prescription drug monitoring programs, patient review and restriction programs, better, more effective laws that enact and enforce drug overdose prevention, and access to better treatment programs. I know that some of you may not be moved by my settlements, but I will ask you, what if one of your loved ones was affected by opioid dependency? What if you didn't know until it was too late? With this policy, prescription drugs will be monitored and tracked and alert the proper authorities when there is a possible abuse or diversion going on. This policy could save many lives and keep families together. It could end an epidemic. So I ask that regardless of your political affiliation or personal beliefs, let ethical guidance guide you in making your decision today. Do what is ethically correct for the greater good of the public health system. It has been an honor presenting my presentation to you, and good night.